Good afternoon, everyone. I'm going to call to order our Children, Seniors, and Families Committee. This is Thursday, November 20th at 1:30. I'm Sylvia Arenas, your chair, and I'm going to look to Camille to help us establish quorum.
Okay. Vice Chairperson Yung
Here.
and Chairperson Arenas.
And I'm here too.
Thank you. You have a quorum.
Awesome. This allows us to move on to item number 2. This is public comment. And this item is reserved for any person desiring to address the committee on any matter not listed on today's agenda. And before I go on to all of the instructions that go for public comment, I'm going to check in with you, Camille, to see if there's anyone.
We have one hand raised on Zoom.
Okay. I think we already know that the instructions for in-person, in case somebody walks in. For that person online, I'm going to do 2 minutes.
All right. So we'll go ahead and open the queue. Our first speaker is Parent. Parent, you'll have 2 minutes to speak. We are unmuting your mic. And when you're ready, please go ahead.
Yes, hello, good afternoon. I've told you guys many times about the sexual abuse of my kids, that my son reported that my ex-wife was letting a man rape him beginning at the age of 13, that there had been unnecessary bathing with the children, that there had been sexual contact between 2 of the children, and this caused a lot of distress to my children. They became anxious, withdrawn, and depressed all the time. And the problem is that I can't get the county to conduct a screening. No screening has ever been conducted, and I mean, it should be clear to everybody here in this room, everybody who's listening, that screening is required here. I mean, it's mandated, and I can't get Wendy Kinnear Roush, Daniel Little, or Sarah Duffy to help me get a screening for my children. I understand that there's a conflict of interest in this case, that my former attorney and a retired judge, they just want the sexual abuse to continue. And the county is favoring these 2 people, their opinions, their unlawful and sick opinions, to preclude the county from conducting a screening. And I just don't understand, because they need a screening, and we know that they need a screening. And it's apparent to me that the county is just waiting for the very last child to age out. And it's just crazy that I can't get a screening for them. And it's like a sick practical joke where everybody knows that my kids need a screening and I can't get one for them. Please, if there's somebody here that can help me get a screening, my name is Ben Z, and Supervisor Lee has all my contact information. Please help my kids get a screening. Thank you for your time.
Okay. Thank you, and that concludes public comment.
Great, thank you so much. I appreciate that. We are going to continue with our agenda and move on to item number 3. This is approving consent calendar and changes to the committee agenda. And at this time, we are going to see if we have a motion from my chair. I think at this point there's only item number 9 and 10. But if there's any other additional changes, I'd love to hear that from you.
I have no changes. Happy to make a motion to approve the consent calendar and agenda as is.
Wonderful. Okay. And let's see, any public comment?
We do not have any requests to speak.
Perfect. Thank you so much. We are going to look to you, Camille, to do a roll call.
Vice Chairperson Yung
Yes.
and Chairperson Arenas.
And I'm going to say yes, too.
Thank you. Motion passes.
Awesome. Okay, so we're going to move on to regular agenda. This is the receive a report from the Office of County Exec, Public Health Department, Behavioral Health, Department of Family and Children's Services, Office of Children and Families Policy, Office of Supportive Housing, Office of the County Council, and let's not forget the Probation Department, and lastly, Santa Clara Valley Healthcare, all relating to the Latino Health Assessment recommendations. Long list of stakeholders involved because this is a coordinated effort. Welcome, everyone.
Well, thank you, Supervisor Innes, Chair Innes, and Vice Chair Young. I'm pleased to be joined by the senior and executive leadership of almost every department and agency you just named for exactly the reason you described, which is that the work that is coming from the recommendations of the Latino Health Assessment is necessarily being integrated into work happening in almost every single department in the county. And so what we bring you today is just the first quarterly report describing, in fact, just a subset of what has already happened, especially things that have been completed, major projects, major milestones, as well as a work plan describing the vast majority of action items and strategies going forward as a result from the Latino Health Assessment. In addition to that, you'll see 4 memoranda by Mr. Lorenz of Santa Clara Valley Healthcare describing in much more detail the deep amounts of work happening within the healthcare system. And I also want to add that in addition to the detailed and extensive list of action items that the board referred to us in response to the Latino Health Assessment, we've also, in our individual departments, made a concerted effort to incorporate findings about disability and communities with disabilities into these action items, making sure that we are not taking our eye off the ball at examining the way disability intersects with Latino identity in some of the outcomes we described. So with that, I'll leave it to my colleagues to introduce themselves as we answer your questions, since I know you know the folks up here well, and we're happy to take any questions from the board. Thank you.
Thank you. Go ahead.
Oh, would you like introductions from
Oh,
everyone?
I thought you said you wanted, you were going to have them do an introduction, but you said no because we know everybody here. Now, I'm playing
at your
back
discretion,
I'm playing
Chair.
back the tape recorder inside my head. Okay, wonderful. I don't know if there's anything else you would like to add, but I think Dr. Rubman, you did an excellent job. So if there's nothing else, I'm going to look to my co-chair for questions or comments.
This is an initiative that your leadership was critical to, Chair, and I really would be interested in hearing your thoughts first and then following suit in discussion.
Perfect. And you know whose thoughts I'd like to hear also first are our public's. Let's check in for public comment.
There are currently no requests to speak.
Oh, I'm surprised. Well, listen, I'm going to start off with a lot of just kudos because I know that there's been a lot of really wonderful work. I don't know that I've seen, and I've only been in the county for 3 years, but this kind of collaboration across departments is just really impressive. It takes a lot of work, and I truly, truly appreciate it. And more importantly, I think our community and our residents will appreciate it because they deserve it, right? They deserve for us to be coordinating and partnering in a way that facilitates the delivery for services and optimally focus on their well-being. So there are a couple of things. I really love how you the report and being incorporating all of the departments into the LHA this way, I think really makes sense. But you did highlight key findings and updates by the domain, and so I'm just going to ask some questions based on that, if that's okay. All right, so I'm going to start with the dismantling historical discrimination and marginalization. And I know that we had already some conversation about that yesterday. It was a very interesting conversation to have. And I think this is sometimes the key to some of the answers is having these conversations and then really looking to you all as experts in your respective fields and how you incorporate and blend in a strategy to be very responsive to our community. So one of the things that I was hoping that you could help me figure out is, did you have any updates based on the conversation from yesterday? I don't expect you to have anything concrete, but if there's any thoughts as you sat with it for 24 hours, if there was anything that you wanted to mention. I will mention to my chair, one of the things that I had discussed with the team, or a portion of the team yesterday, was that because I understand from the LHA, there was some issues that impacted, I believe it was Pacific Islanders, in a more severe way than Latinos, and I cannot ignore some of those facts. And also, because our children of color tend to be targeted, especially in the school to prison pipeline, I wanted to make sure to bring in some aspect of that into the conversation. I don't want to lose the Latino, of course, the Latino focus is what I primarily want, but in the effort of advocacy and changing our strategies, I want to make sure that children of color, especially those that have been found historically involved not only in our services, our child welfare services, but certainly in our juvenile justice system, also gets some love and attention, and of course, strategies that pertain to them. And so I know that that's something that's just recent that we discussed. It also outlines some of what we find. I think a real life example is what we talked about. In certain parts of our county, we have seen electronic bikes or large bikes. Not all of them are electronic, but some of them have those big tires. And there's a lot of kiddos. We all drive and interface with them at times, or see them down the street and they're in large groups, right? And so it's an alternative way of coming together. I personally think it's a really neat thing to see, because they use their agility to do all kinds of tricks on the bike. Now, for those who are in law enforcement and for those of us who are drivers, we may not want to interface with them and want them to really diminish their participation in the streets and to keep it in the sidewalks, right? And so I think there is a really great opportunity for us in real time to figure out how do we as a county help shape and support and give space to these conversations without creating punitive consequences for our kiddos. And one of the issues that we talked about in the South County Youth Task Force was that, at least for me, this is what I brought up, that kiddos who first of all, I think we need to recognize and lead with acknowledging the developmental stages of those kids, right? And those kids might probably are in that stage where they're pushing back on authority, where they're looking for some risks. And as parents and as stakeholders, we need to figure out how do we hold space for them to have those safe risks, right? Even for our own children, when they push on boundaries, we have to figure out how do we hold space for them? How do we hold or find opportunities for them to create risks and have that experience in their developmental stage? And so for parents, it could be, for me as a mom, I enrolled my kid in the skateboarding park over at Lake Cunningham. He could, do all the loops and whatever he needed to do. But that's an alternative, right? That means that there's something available in our community. And in Gilroy, it's been so under-resourced. There's not a community center for our youth, and so our youth are taking it on themselves to figure out how do they keep themselves involved, united, taking risks. And I think this is a symptom of not only under-resources for our youth, but this longstanding history of Gilroy and Morgan Hill just being, kind of kept to the side. So if we can take some of these examples that are happening in real life and work with our communities, I think that would be the most optimal and ideal for me. And that would mean that we are, in the moment, really being responsive to our community, not allowing for policies to then be punitive and for waiting for the fallout. And we'll see in one of our items here later on that our children of color are receiving referrals for low-level offenses. And so it really connects some of these dots. All right, so that is my piece for Latino health assessment overall. I mean, I think there's a lot of really wonderful opportunities for us to continue to grow, to continue to provide support. And so one of the things that I actually wanted to ask about, and this came from folks who gave us feedback, and this is the increasing access to quality care and improving health outcomes. We know that there's certain clinic deserts, and east side of San Jose near Mount Pleasant is one of them, and South County being the other one. Paul, how are we addressing this? What are we doing? What's happening?
Thank you, Supervisor Arenas. It's truly a pleasure to be here and talk about these important aspects of our plan going forward. From a health perspective, and I would say that the convening that you had really did provide a basis for our team to really think through where we can do better relative to health access. Let me just walk through a couple things to kind of highlight what we're focused on. So as your board is aware, when we acquired Regional Medical Center, we also acquired an outpatient clinic on that campus, and that clinic is going to be known as Valley Health Center McKee. You know, going forward, you know, it may be important that we rename that clinic to really reflect the community that it is serving. And that's just one bit of information that our team walked away with, and we've heard from others about, you know, if we really want this to be a community clinic, then it really needs to represent the community by name as well, and not just the services provided, so there's a sense of ownership. In that clinic, of course, we're expanding and bringing about a lot of different specialty services that have been missing in that community for quite some time, ranging from women's health to, you know, readily accessible services around urgent care for both adults and pediatrics, and a wide variety of outpatient specialties, both medicine specialties and surgical specialties, from cardiology services to orthopedics to urology, ophthalmology. So we've already started to add many of those specialties, but there are plans to bring more based on feedback from the community as we continue to understand the needs of that community. The other thing that's happening, particularly in the South County, you know, as you've pointed out numerous times, there are certain types of services in the South County that have been missing for quite some time, and in fact, never been in existence. And these also include services around pediatric care, around women's health, but also around many specialty services. And we're very proud to say to you that we've begun that process. Cardiology services for that community. Individuals would have to travel if you're not part of, you know, a major provider such as Kaiser and our system. People would have to travel into San Jose. And so what we're doing is actually bringing specialties to the campus of St. Louis Regional Hospital and working very closely with other safety net providers, Gardner Health, Bach, and others, to make sure that we keep those services available for that community, receive the referrals, and serve those individuals in that community in a culturally and supportive manner. And I can go through many of the different specialties. We've actually hired specialists to actually serve that community specifically. We hired a cardiologist that will be the primary medical base of operations will be in the South County. Most of you know that we do provide a very vast network of pediatrics care and obstetric care through our large group practices, and we are working very closely with the medical staff to make sure that those services remain accessible to that community and do so in a very sensitive and cultural supportive manner. Primary care behavioral health, which is really the front door relative to identifying individuals that have needs around mental health and substance abuse issues. So we are further expanding our effort around the access to primary care behavioral services, where we can provide the initial assessment and identification of issues that we need to follow up on. We are also exploring community-based satellite clinics, and let me explain what that concept is. So we have very large health centers, and as you well know, these health centers provide for what I would characterize as under one roof, from urgent care to dental services, including some specialties, but also not just primary care, but internal medicine. What we are contemplating is actually opening smaller neighborhood type of clinics, small practices that are very nimble, that can really reflect and serve neighborhoods within communities, where people can find ownership of that clinic that's reflective of their needs from a cultural standpoint. And these clinics will be associated with large health centers, so they're quote-unquote satellite clinics where we can take advantage from a financial standpoint, the federally qualified health center rates. So these clinics are very easy to stand up. It's really identifying the location that would, where it would benefit the community. And we would work with the community to establish those types of clinics. Those sites would be much more feasible to bring about, even in our fiscally challenged times. So those are some of the concepts that we're bringing forward to really address access to care in a much deeper and meaningful manner relative to the specific communities we're serving. And I would say it's just not in the South County or in the East areas of our communities, but I think county-wide this model can be replicated to serve other communities that we find to be disenfranchised or having issues around accessibility. So it's really a model that we're looking forward to, that through this effort, Supervisor Arenas, that has come about in terms of our planning as a health system. And all of this is going to be driven by the data and really understanding more specifically around the needs of our population. I know that's a lot, but I just really wanted to summarize all the effort underway.
I truly appreciate it. I got a chance to meet the cardiologist in July when he came on board, and I took an additional tour of St. Louis. I had already been there a number of times, but we took a look at it with a different lens. So completely appreciate that. I know that having that kind of specialty on site is really important. The other piece that I wanted to ask in relation to St. Louis is obstetrics and the OBGYN delivery. Most of the patients who are delivering, because South County has a lot of babies, they're not getting delivered at St. Louis Hospital. They're getting delivered at Valley Med. And I'm really concerned about this kind of strategy where we are making our women drive all the way to Valley Medical Center, knowing that Latinas are at a higher risk for geriatric diabetes and other complications. I just don't understand. I've been asking this question for a number of times, and I cannot get to the bottom of it. How can we systemic way address this? Because it just doesn't make sense to me.
Thank you, Supervisor. If I may kind of take a step back and then really get to the core of your question. So as you very well know, and this is something that we're very fortunate as a health system, being a public system, able to maintain labor and delivery services in that community at a rural hospital. Mm-hmm. And as people well know, throughout the state, one of the key services that many disproportionately served communities lose is labor and delivery services because of the high cost related to having the appropriate specialist, anesthesia coverage 24/7, right? To maintain a unit, you have to have these core services. We've made the commitment because of the reasons that you're speaking of around equity to maintain L&D services at that hospital at a cost relative from a financial perspective, but we look at it much more so from a community standpoint, to your point. So we are committed to maintaining L&D services in that community. One of the things that we're challenged with is volume. Right now we average maybe 30 deliveries a month. Based on that community demographics and the expected delivery, if we were able to shift all of the deliveries that we would have responsibility for and could obtain, we're talking about probably doubling that to maybe 60 deliveries a month. And that's still low volume. And so it's really important that we maintain the level of competencies relative to our staff and our physicians to be able to see certain types of patients that may, as you point out, have certain chronic conditions and may be supported. So what we are doing, Supervisor, is working very closely with the medical staff to make sure that we work with the physicians and make sure that we inform the patients that it is okay and it is safe to deliver at St. Louis Regional Hospital, because it is part of it, a patient preference of where they want to deliver. Some families prefer to go to a hospital that may have advanced services, such as a neonatal intensive care service. So there's some dynamics there that we are trying to work through that we will continue to focus on.
I understand, and I think I understand very well because I had a baby in NICU, so I totally understand this. I still like to have an off-agenda report reflecting what those numbers are. Gilroy has a very young generation of Latinos, and so and continues to have a pretty decent number of births in South County. Now, I don't know Morgan Hill. I can't say for Morgan Hill. I just was remembering Gilroy, but I just would like to get that offline from you, because this is something that I know has been a concern for a lot of stakeholders and advocates out there. And I just want to get to the bottom of it. So if it's data,
Understood.
then I'd like to see data, and then put this to rest. As far as the community-based satellite health centers, and this integrative, all under one roof concept, I really appreciate it. I do want to just remind you that my side of the county has been seeing a lot of investment in regional and in now the additional clinic that was connected to it, and yet they have a emergency department that is stretched out to a parking lot
Yes.
under a tent. And the improvement is going to be a what is it called? The
Modular.
a modular, which is still unacceptable. And so I really want to stress that my community continues to tell me about all of the great things that are happening in San Jose, and yet they don't see the investment. So either I'm not doing my job or we're not listening. And I don't think it's either. So I would really like for us to be considerate about those communities that have truly no access or very little access to the resources that most of San Jose has been used to. And I'm not trying to take away from any other parts of San Jose, but certainly I think when you think about an emergency department in the parking lot, I think we kind of hit a low. We've hit a low, and that was okay for the pandemic. We're way past it. And so I don't know that I can continue to accept investments in other parts of San Jose or any parts of the county for that matter, when Latinos in the south part of the county are receiving this kind of service. All right, I'm going to move on to housing and homelessness. I know for this piece, one of the recommendations I believe was to increase the section 8 vouchers, and I don't know if there was I know that was one of the recommendations. I don't, Measure A obviously is our solution to a lot of our problems under homelessness, but we need to have additional solutions outside of just that, because obviously all the money is spoken for, or at least most of the money, the majority of the money is spoken for. So can we talk a little bit about what kind of strategies can we continue to really work on that are realistic? Is it working with landlords so that we can increase their comfort level for Section 8 vouchers, and that way it's something that folks are more accepting of? I was actually talking to a landlord who was gleeful about the Section 8 voucher because it's a consistent source of funding, right? They don't have to wonder whether that money is coming in. The lesser portion of it that is covered by the tenant is something that the landlord thinks about. But I was really surprised because I don't know if most landlords feel this way. Is there something that we can think about working with an agency so that we can continue to increase Section 8 vouchers?
Supervisor Arenas, I'll do my best on this one. The Housing Authority would be our key partner in that effort, but I think probably to answer your question more fulsomely, I would need assistance from Consuelo and KJ, who are unfortunately not with us right now, but we will get back to you and make sure we give you a full answer on that question.
Perfect. I appreciate it. I think for me, those kinds, I think that's, oh, no, the violence prevention, I skipped this one. Now I know that some of the key updates are about the CAC, bringing that to Morgan Hill, monitoring the federal immigration enforcement impacts, and a couple of other updates. One of the updates, and I don't know if it's in this report or another report, but there's a noted decrease in calls for child abuse, right? And so if we know that there's less child abuse cases, how are we, and we do have a pilot program already happening with DFCS, stationed out into schools so that we can facilitate those calls and those connections. How are we following the data, or how are we working with DFCS so that we know, this pilot is actually working, the increase is happening? Not that I want increase, obviously, I don't want any child abuse calls, but we know that there is a certain number of calls that we typically expect, unfortunately. How do we gauge that, Wendy?
That's a really good question, and I think what I can offer is that we have set up a subcommittee to take a look at how will we know we've had success on this pilot and having social workers out at the schools. And so I think we can connect this work and absolutely join in with some of the items that are coming up with Latino Health Assessment and look at some ways that we would want to look specifically at that. So I think we've looked at how will we know if we've had success. I agree with you. I don't necessarily want calls decreasing coming in. I want the calls going to the right place. So at the end of the day, you want the right calls coming into the Child Abuse and Neglect Center, and you want those families that need resources connected to resources. And I think the gaps that have been highlighted in the Latino Health Assessment, we can make that connection.
I agree with you. I don't want to see any more calls, but I do want to see maybe the connection to services. I think that for me would speak in terms of improved outcomes. When somebody is walking you through the process, I think you're more likely to accept services because there's a face to it. There's somebody you've talked to. There's, a bedside manner of that social worker that may allow for that commitment from that parent or that buy-in from that parent in a very different way, or caregiver or adult to participate in services. So yes, if we could figure that piece out, that would be wonderful. And I know I'm going to skip over to, and thank you so much, Wendy, I'm going to skip over to to the key updates for providing opportunities for children and youth to succeed. There is too many updates, and it's a good thing. There's too many updates for me to list, but everybody has the report in their hand. I just wanted to make mention of for us to continue to look at the gaps in childcare, especially since this is a new system, fairly new system that SCOE provides referrals, that Go Kids handles the voucher aspect of the childcare, and seeing how we can support that in any way. I know that there's always an opportunity for us to be supportive. I don't. I know that Council Member Pamela Campos is right. You're shaking your head. Yes, she's very key on childcare, as well as Supervisor Ellenberg. I am too, but I stepped away from it because I know that Supervisor Ellenberg was leading in that area, and there's no need for me to get involved when we have a really great champion already in that space. But it is something that concerns me and worries me, and it's one of the ways that I know that child abuse can be mitigated as when it's a crime of opportunity, right? And so, any updates, or maybe what I could ask you is to be involved with us in our joint meeting for DFCS and the neighborhood. I was the chair of that committee. Neighborhood is it safety? NSC. Yes. We got it through all of us, even though I was the chair of it. And we did a lot of really great work when Supervisor Chavez was here. The name doesn't matter. The work is what it speaks for itself, right? So anyways, I think that's another opportunity for you all to participate and to maybe carry out some of the work that belongs to or is falling under the LHA, to also be part of the joint effort between the city and the county. In that way, we have additional partners. Okay, I think for me that is it. If I happen to have something else, I'll pipe up. But for the moment, I'm going to look to my co-chair and see for comments, questions.
Thank you. I really appreciate the conversation. And first, I would like to thank my colleague, Supervisor Arenas, for her leadership on this initiative. And to all the staff here today, we've got the greatest hits, the brain trust here of the county, working on this, on the Latino Health Assessment Report and its ongoing work. The assessment really illustrated for me, and I think for many policymakers who are looking to Santa Clara County in terms of health equity and, alongside all the values that we hold dear: community safety, family stability. And in my district, with 38% of our Latino community calling Eastside home, this is something that I'm really grateful this county has embarked on, and for Sylvia, for your leadership on this. As the first quarterly report, it's a great foundation and action plan that I look forward to seeing more fully developed. And I know that as we get into the details of the work, the timelines, with the broad timelines, I know that with each iteration, we'll see further definition and detail. So I'm excited to see that. Earlier this year, I toured the new McKee Clinic. I agree, we should have a new name for it. No offense to McKee, whoever that is, or maybe. And I'm very excited to hear about the women's health and expanded pediatric urgent care plans for that there. Like you said, Paul, these are services that this community has not had before. So it's really heartening to hear that not only are we reinstating what HCA left behind, but also bringing additional resources to meet this need that has been neglected for a long time. And with the clinic opening in April, really would like to hear our plans to create awareness around the new health clinic, if we have any plans for a community open house in the new year, and how are we looking at the services in relation to our patient needs and population at Regional Medical Center?
Thank you, Supervisor Young. So we do have a lot of different initiatives underway. Since we opened, as an example, the labor and delivery at the hospital, we're about to open up in the outpatient side at the McKee Clinic, the Women's Health Center, which will position our physicians on that campus. And in our ability to inform and educate the community will then be underway, meaning that we are going to make sure that the community knows that they have obstetricians, gynecologists in their community and available to see them. And so we are going to do social media, general media outreach and education, community education, work with our referring providers in the community and other community-based clinics. And that will also align with many of the other specialties that we're going to add to that location. We do plan on probably in probably in the first quarter, having an open house for the community to really announce and reiterate what we're doing for the community. And that's something that we can keep your office informed on. So a lot more to come relative to those services.
Thank you, Paul. I look forward to helping with outreach as well and any type of communication that we can amplify so neighbors know that the clinic is there and that all are welcome and that we're all looking forward to serving and sharing our resources. Yeah. On the data collection analysis, this is an area that I've been interested in for sure at least the last 5 years since we all met at the COVID Emergency Operations Center, where data reigned as the lead strategy in formulating a response and mitigation plan. Given our learnings during COVID about who was most at risk and who was suffering the most, we knew that it was the Latino community and the essential worker population that had no option to shelter in place or somehow even separate themselves from the spread of COVID. I read that there is an administrative policy coming in 2026. Really would love to hear a little bit about that and how this policy will be implemented and how long will it take to implement. What is TSS's involvement in this? To anyone?
Supervisor, you're talking about the policy related to kind of uniform data collection. It's been a little bit of an odyssey with this policy. We were well underway on the work, and then there was actually pre-Trump administration some new guidance issued at the federal level. One of our challenges here is trying to make sure that we're uniform across the board, doing sort of best practices around data collection, but also ensuring that we're doing data collection in a way that allows us to accomplish all of the reporting in the way we're required to do the reporting for a lot of the state and federal programs for which we're required to do data collection. So we have revisited what was a pretty fleshed out draft of that policy that kind of predated this new guidance to better align with some of these actually really positive changes in what had been some of the outdated language, particularly pertinent to work that we would do under the Latino Health Assessment, where Latino identity was actually not well captured, for example, in the census data historically, where a lot of folks who were Latino asked to check a racial identity that didn't align with how they self-identify. So some improvements there at the federal level that are incorporated in our policy, also combined with some better and richer data collection around sexual orientation and gender identity. And so that policy is being finalized in draft form in collaboration between county administration and county council, and then will hopefully be ready to roll out in the first part of 2026 next year.
Very exciting. Thank you for that. And just kind of jumping around here, I think I'm also super excited about the access to quality care domain and the opportunities to enhance and expand our way of thinking about the clinics and what you were talking about, Paul, how we create culturally welcoming spaces and services. And learning more our approach in particular about promotores and community health workers. Would love to know what our current approach is, and then I have some follow-up questions depending on how our approach is defined here.
Thank you, Supervisor Young. So I think we all agree that the promotores model is a model that we need to further integrate in terms of our different programs. And although we use it, I do not think that we've fully utilized it to its full potential. I've had discussions with the Health Trust and others about how do we actually create a situation where we further support such models in our communities throughout the county. And from our perspective, what we need to do is develop that model in a manner that it's sustainable. Because I think what we've seen is some of these models start, but they're not sustained relative to certain programs and services. So I think we need to bring up a means to bring about sustainability. And that was part of my discussion with the Health Trust in terms of how they can help various communities develop the model and create sustainability around it so that we can draw that connection with the communities that we're trying to serve.
And I can follow up on that, Paul, if that's
Yes.
okay. Supervisor Young, the Public Health Department is taking on this area. We have developed a plan of moving forward with engaging the community and organizations that work with or hire or employ community health workers or promotores. Today was the kickoff of that planning process. We had very, very good discussions. The community health workers and promotores is not something new. This has been around for decades and decades and decades, really, spearheading from grassroots organizations and community health centers from years ago, and it continues to be a challenge to sustain those activities. But we do have several organizations throughout the county that are employing, partnering with, supporting community health centers and promotores. So we have a design team that's represented by the organizations, and then we will be convening promotores to come back in the spring with recommendations. I will say and share honestly with you that, one of the things that we're hearing today is times are hard. These are really difficult times when these residents and community members are already working with populations that are experiencing much fear, much difficulties to navigate systems and understand what resources they need to have. These are really difficult times. We're in a structural deficit time also right now. And one of the things that I want to share with you today is two things. One is the promotores felt that we should, along with developing recommendations for a robust, sustainable promotores program that was highlighted in Supervisor Arenas' memo, that we also identify some policy issues that really inhibit and create barriers for promotores to do their work and really work on those policy issues as well. And then I think the last thing is, the network of community health workers and promotores and nonprofit organizations that are doing this work now are tapped frequently, and they spend their time helping us understand what an ideal promotores work would be. And they want to make sure that we do the best that we can by following through with action, that if we do this planning, if we figure out what a real robust, sustainable promotores looks like, that we have some commitment to action to making sure that their time spent in helping bring this forward was worth the investment of their time. So we're excited about it. We had representative from Supervisor Arenas' office join us today. We hope that by spring, we'll have some preliminary report back on what people are recommending.
Thank you for sharing that. I think as we progress on this work, there are a couple, policy questions I have that doesn't have to be answered today unless you have something ready to go for it, but something that I would love for us to ponder or mull over. The certification process for a community health worker, making them eligible for reimbursements, there's been a considerable work and investment in community to lowering the barriers to having that certification. My policy question is that should we be emphasized, like what is our position when it comes to should promotores be trained up to pass to be certified by the community health worker standard, or should the legislative policy approach be the opposite, where we define community health worker standards to be inclusive of the promotores' work? And what would be the pros and cons of both approaches, either approaches, and if it's feasible? And I'm looking at Monica in the back there with IGR, that this is something that might be serving into your lane as well. And then something that I'm also interested in seeing if this may be an aspect to our work here is the worker-owned co-op model. I recently attended a statewide worker-owned co-op convening, and there was considerable presence from promotores, co-ops from around the state who were there. And so is that something, when we talk about sustainable models of promotores' work, is that one of the models that we can pursue or approach that also lends to economic development, economic inclusion for populations that may be denied access to conventional economic channels, right? If this is something that should be part of the plan or part of the development. Really curious to see what the experts think about that. I know for me, from a workers' rights perspective, being able to take the boss, right, out of the equation and creating an ecosystem where workers are defining their own terms and conditions of what workplace safety and workplace rights look like is particularly inspiring for me. But then for this to feed into the needs of our healthcare work would be full circle policymaking. That really excites me. So I think those are my questions when it comes to that. I'm really interested in hearing what y'all, as this work progresses, how we approach these policy questions. Unless anybody has something to say now, any comments? Don't want to stifle any of that. TBD. Yeah, okay.
I'll just say thank you. Those are fabulous questions. I'll really look forward to hearing what the Promotores and Community Health Worker Group has to say about that, because I think they're spot on. Thank you.
Okay, thank you so much. And then, let's see, just a couple questions here. I read that in 2022, we established the Office of Health Equity and Improvement. Would love to see in future, like if this is a proper lane, what the office has learned from its inception, how is the data and information being used to improve health equity, specifically in relation to Latino health assessment. Would love to see more of that work that's already been in place since 2022 help inform our conversations.
Thank you for that, Supervisor. Most definitely we'll be able to come back and share an update on that.
All right. I think that's, one last question. The Behavioral Health Learning Partnership training courses on cultural humility, it's available to all, is that available to all county employees or just our healthcare employees? And I should be more direct with my question. The reason why I'm so interested in this is that I would like for my office to have this training if this is something that is suitable for non-healthcare folks.
Thank you, Supervisor Young. Right now, our classes that are offered through our learning partnership is typically for our behavioral health staff and our network of providers, but we can definitely look into some potential options that we might be able to facilitate.
Oh, thank you. I appreciate that. And something that came up in the earlier conversation, I know I represent District 2. However, we all serve to represent and serve all residents of Santa Clara County. And Supervisor Arenas, you brought up, this is not the first time you've brought up the concerns around the emergency department in St. Louis, which is also worrisome to me. So Paul, I'd like, turning to you, if you could tell me more about what is the setup out there right now, and what are the future plans for meeting health equity and health access needs where they are?
Thank you, Supervisor Young. And let me just start up by saying that I share the pain that Supervisor Arenas has described relative to our emergency room capacity in our facilities. When we acquired St. Louis Regional Hospital, and since that time, the emergency room volume has grown by close to 40%, and that number continues to climb, and we expect it to grow even further given the needs of the South County residents. So it is an equity issue relative to providing access in an appropriate manner, meaning that when you have an 8-bed emergency room and you're serving a population that should have an emergency room of at least 20, 24 beds, it is a problem. And so what we've done in order to bridge the gap, because first of all, we have done and prepared some preliminary designs of an expanded emergency room along with additional bed capacity, along with the appropriate ancillary support. We do have that as one of our capital project requests into the county exec's office, and it is on the list that the board will review relative to how we go about funding it. It is one of, if not the top priority for the healthcare system in terms of major facility projects. In the meantime, though, we have to bridge that time gap because we cannot just build a hospital in a year or 2 years. That alone is just probably the HCI design process once we get approval from the board to fund the project. So with that in mind, the only feasible thing that we can do that can be approved by DHCS, CDPH. DHCS is on my mind lately, but the Department of Public Health is to do so through the modulars that we have now started to place on the campus. And those, of course, are the facilities that Supervisor Arenas was referring to. They're not ideal, but they're the best solution we have to provide for the services that are needed in that community. So that is where we're at today. And as I said, if we can come up with a better solution, we will. But in the meantime, this is only the feasible interim solution that we have before us. But I share the supervisor's pain. I can tell you when I'm down at that hospital and you see the volume of patients that are being served by that hospital, it continues to grow. And it is disproportionately, as we've talked about here, individuals in that community that are of color, right, in the very population that we're trying to address. So we are doing our very best, and we will continue to focus on this as a top priority.
Thank you, Paul. Just help me recap for me what the next operational steps are to moving through this interim solution towards conclusion.
So once again, it is on the capital projects list. Greta can speak to it in more depth, but then it will come to the board for consideration for funding once we have that identified.
Yeah, I can speak to that. And one thing I'll just share about the interim solution, in addition to what Paul shared, and Paul, please chime in with additional details. As Paul mentioned, we purchased a hospital with far less emergency department capacity than the community needs, and that's really put us, from the moment we acquired St. Louis, kind of in a very difficult position because, as Paul mentioned, it's a multi-year process to even get approval from the state to proceed with the type of construction we need to do here. So I appreciate the ingenuity to quickly ensure we could deliver the volume of emergency medical services sooner than that by purchasing. And these modulars, obviously not nearly the long-term solution, but these are, multi-million-dollar custom-built portable emergency departments. They're not a typical modular construction. They're specifically constructed to provide, sort of in a field-based setting, an emergency expansion to an emergency room, which will bridge us to that really critical long-term solution. And so the board should expect to have the opportunity to approve further investment in that long-term solution through the capital process, which will be part of the budget process this year.
Thank you. Thank you for the clarification. I look forward to seeing this item come before the board.
Thank you.
Thank you. Alrighty. No more questions, so thank you for the presentation, thank you for the updates, and I'll be following up with you offline. Thank you. All right, we have a motion. Do we? No, we don't have a motion. I don't think I heard one from you.
Oh, motion to receive report.
Awesome, and I'm going to second that, and then Camille?
Okay.
You'll take
Vice
us?
Chairperson Young?
Yes.
And
I'm so
Chairperson
sorry. Have we
Arenas.
taken public comment?
We did, yes.
Yeah.
And
Yeah.
Chairperson Arenas?
Yes.
Thank you. Motion passes.
Perfect. Alrighty, we are done with item number 4. We're going to move on to item number 5. Thank you, everyone. This is receiving a report from the Probation Department relating to the annual Juvenile Justice Data Book for calendar year 2024, including census tracked juvenile arrest trends. And so, welcome. Because it's the data book, you brought your own laptops. I love it.
Thank you, Supervisor Arenas. While our team sets up, we'll just start with some introductions. Mariel Caballero, Deputy Director, Probation Administration. With us today is Eduardo Esteves, who is a Associate Research and Evaluation Specialist and has been doing our data book with the RAD team for about 3 years, so we're excited to have him present today. And our Program Manager 3 of our Research and Development Unit, Kimberly Jatko. So with that, we will be presenting the 2024 Annual Juvenile Justice Data Book, which includes a variety of interesting information. I do want to highlight that it is not an outcomes report about how youth are doing in our system, but really it's about who's in our system, who came into our system in 2024, and what their demographics and whatnot look like. So we also have some really great updates to our secure youth treatment facility numbers and some information there. And I will stop talking as soon as Eduardo lets me know that he's ready to go.
Eduardo, no pressure.
I
You
know.
just-
He tested it earlier and it worked
no,
great.
I'm kidding. Really no pressure. We know sometimes computers don't work with us, especially when we want them to.
It looks like Eduardo needs a permission to share.
Permission granted. I don't know.
Camille, can you help us out?
Okay, while you do that, I'm just going to no, I'm not going to skip to public comment because in case our public has any questions about the presentation, which is really, really detailed. Oh, wonderful.
Thank you for your patience. Yes. All right, so today I'll go over the 2024 Juvenile Justice Annual Data Book. So, here we go. So here are the items that we'll be going over today. First off, I'll be covering the 5-year juvenile arrest and citation trends from 2020 through 2024. I'll also be covering disproportionality and disparity gaps, top 5 arrests and citation categories, arrest citation geography, juvenile hall detentions, child welfare records for the 2024 probation population, and the duly involved youth DIY program, also secure youth treatment facility, and the principal service needs. Okay. All right. So here we have the 5-year arrest trends, referrals to juvenile hall, and admissions to juvenile hall. So in 2024, there were a total of 2,281 arrests and citations, which is an increase of 4% from the previous year. It is important to note that while we are trending upwards since the 5-year low in 2021, we are still well below pre-pandemic levels. So compared to 2019, we are down 32% in arrest.
We're just going to see if we can fix this screen share so some of the text isn't blocked.
Is that better?
I think so. There's still some black boxes showing up on on the public view. I want to make sure we can see all this wonderful information you have prepared. Okay, thank you.
All right, yeah, so we also see similar trends to referrals to juvenile hall and admissions to juvenile hall. So referrals to juvenile hall were up 14% from the previous year, but that's down 26% compared to 2019. And juvenile hall detentions were up 13%, but down 32% compared to 2019. Okay, so here we have a brief look at the number of arrests versus the number of unique youth. So again, 2,281 arrests in 2024 and 1,842 unique youth that were arrested. So that's a 10% increase from the previous year. So here we highlight the disproportionality of arrests and detentions. So disproportionality highlights how different an event is occurring to a specific group compared to that population size of that group. So here we see that our black youth account for only 3% of the youth population, but make up 9% of arrests and 13% of detentions. And we also see that our Latino youth account for 35% of the youth population, but make up 67% of arrests and 77% of detentions. Okay. So here we highlight disparity gaps at key decision points. So for this, we calculated the arrest, referral to juvenile hall, and detention rates for each group, and then we compared the rates of non-white youth with the rates of white youth. So doing so, we saw the largest disparity gap occurring at arrest for black and Latino youth. So black youth were almost 7 times more likely, and Latino youth were almost 4 times more likely to be arrested compared to white youth. In referrals to juvenile hall, black youth are almost 3 times more likely to be referred to juvenile hall, and Latino 2.5 times more likely. When it comes to detentions, all youth are being detained at almost the same rate, so there's no difference in detentions. So here we see the top 5 arrest subcategories. So for 2024, the top 5 arrest subcategories were petty theft, burglary tools, accounting for 345 total arrests. Misdemeanor assault, fighting, accounted for 233. Obstruction, resisting arrest, felony assault, assault with a deadly weapon, and robbery were in the top 5. Petty theft, felony assault, and obstruction of justice saw a large year-over-year increase. Petty theft saw a 57% increase from the previous year. Obstruction saw a 38% increase from the previous year. And felony assault saw a 17% increase. Misdemeanor assault, fighting saw a 6% decrease, and robbery saw a 6% decrease. So here we see geographical locations of where our clients reside at the time of arrest. The trends remain similar to previous years. 4 out of the top 5 are in San Jose, and with zip codes in Sunnyvale and Morgan Hill appearing in the top 10. So the top 5 are Gilroy, 95020, ranking number 1, followed by San Jose's 95122, 95116, 95127, and 95111, rounding out the top 5. So here we have the juvenile hall detentions. In 2024, 782 youth were referred to juvenile hall, 656 were detained, and 469 were detained until their detention hearing. 40%, or 313 detentions, were referrals to juvenile hall were either not admitted to juvenile hall or they were released prior to their detention hearing. So here we have information regarding child welfare records for our 2024 population that were referred to juvenile hall. So in 2024, there were 1,842 youth referred to the probation department, and out of these, 961, or 52%, had a record indicating some child welfare contact in the past. For youth who did have a child welfare record on file, the median age at the time of their first referral to probation was 15 years old, while the median age at the time of their first child welfare referral was 5 years old. 77% of the first referrals to child welfare occurred prior to a youth turning 11 years old, while 99% of the referrals to probation occurred after a youth turned 11. So here we have information regarding DIY assessments. In 2024, there were a total of 44 DIY assessments completed. 14 of those were reviews that were initiated by JPD, or the Juvenile Probation Department. 12 of the assessments resulted in a duly involved determination, and 2 as a dual status. 20 reviews resulted in juvenile justice supervision only, 1 in child welfare supervision only, and 6 were vacated, placed on hold, or transferred out, and 3 of those assessments resulted in no system involvement. Less than 32% of the assessments entered DIY. So notably, youth may have had a DCFS referral early in life that does not reflect their current involvement with child welfare or probation. But to increase access to services in 2024, the DIY unit began serving youth who were involved in both systems, but whose interventions were considered low level and that did not have a formal petition. So here we have information regarding our Secure Youth Treatment Facility, or SYTF. So in 2024, 9 youth were committed to SYTF. 89% were male and 78% were Latino. Here we have SYTF commitment offenses and their average baseline confinement. So a small number this year, but the ones that we did receive, 2 were felony assaults with a deadly weapon, 2 were attempted homicide or manslaughter, and 2 were robbery. So here we'll take a look at the principal service needs. So we have principal service needs for males that were assessed with the Juvenile Assessment and Intervention Systems tool, or JACE, in calendar year 2024. There were 254 assessments completed. An emotional factor was present in 70% of the assessed males. Relationships was present in 56%, and isolated situational was present in 40%. Here we have the principal service needs for females. There were 38 assessments completed. Emotional factors was present in 89% of the assessed females. Family history was present in 63%, and relationships was present in 61%. And that's all we have. Thank you.
Thank you, and I'm going to ask Camille to see if there's any public comment.
We do have one hand raised on Zoom.
Okay, we'll do 2 minutes.
2 minutes, okay. Our speaker is Parent. Parent, you will have 2 minutes to speak. Please go ahead.
Yeah, thank you for the report. The 52% of children in juvenile hall that they've been part of the child welfare system, that's a very high number, and it's very indicative of what happens to children who get abused. I mean, we should also have a number for adults who enter the criminal justice system. How many of those adults were abused as children? I think that would also be telling, because we'd be capturing the whole thing. But in any case, I mean, this really just goes to show, how this affects children when we, especially when we don't protect them, when we do nothing and we just ignore them. I mean, they probably also suffer in other ways that we're not capturing here in this data. That's why I think it's just such a shame that in our county that we're ignoring these kids. And it's not just me. I mean, there are plenty of other people who are complaining about the same issue in this county, that children are being abused and the county is just completely ignoring them, the parents who are reporting this. And this is something that we really need to change, and I hope that we do. Thank you for your time.
Thank you, and that concludes public comment.
Thank you. I'm going to look to my co-chair, Ms. Orlando.
Thank you, and thank you for that presentation. I wanted to ask, really just want to get your thoughts on what some of this data means. It's a lot of data. I know data is challenging to collect, then streamline, and then hold factors so that the data is accurate and reflective, right, and unbiased. I really would love your thoughts on what this means, like like what can we glean, lessons learned from these data points. For example, our Asian youth have the lowest arrest rate, but they are the largest population in juvenile hall at 39%. What does that mean? Like, from someone who's not involved in not part of your world, what lessons learned can we glean from that? Is it more violent crimes? Is it just grade higher need?
It could be a number of different factors. Definitely because our Asian population that gets referred to juvenile hall is smaller, sometimes those percentages might appear a little bit higher compared to other races. For example, our Latino, we might see 1,000 youth referred to juvenile hall, and then through our risk assessment instruments, we make those determinations if a youth should be detained into juvenile hall. So it could be just a factor of just the volume of youth that we receive from our Asian population, but it's something that we can definitely take a little deeper dive in and see which offenses we're seeing for that population base.
And I think what you just mentioned too, that there's other factors involved, such as referrals, the timing of the referrals, how folks are then, how young people are diverted out of the. I think that those are critical metrics, right, to help us paint as accurate a picture as possible at this population, at our kids and our custodial care, because I think the North Star is for us to intervene, to rehabilitate, and for them to not be further embedded in the criminal justice system. So that would be helpful. I would love to have more understanding to that level of detail to help explain and tell the story of how they're there, and more importantly, how do we mitigate and intervene? I think that's my other question. It's more of a macro question here that I, looking through multiple data reports now, it's very pedestrian gleaning of the data, right? Is that we have a youth that enters our system, that's referring to our system at an early age. Then they're diverted out, they go back home. And then they go back home to a home environment that set the conditions for their entry into our system in the first place. And then now that they're diverted, right? They're out, they're in community, they're at home. Then they come back with us with multiple referrals in the future. And there's lots of considerations that can be true here, right? Do the schools treat them differently, right? Do classroom behavioral challenges that should be a school situation now get referred to a probation officer because this is a justice-involved youth? Or it could be the conditions that created the environment for them to have these behaviors, right, are still there, and we haven't been able to mitigate that yet. Those are the type of the type of stories or the type of like lessons learned or conclusions gleaned that I really would be interested in. Of course, that can't happen without the data, right? But really looking to your expertise and to your department as this conversation continues and furthers, what would be the factors? Because if you just look at it from a data point, you have this youth who came to us and then they come back to us with multiple referrals. And if we're able to tell that story, whether it's bias in the public education system or the lack of intervention and supports in their family home life, that would be really helpful to know in terms of what investments we need to be making and what type of outreach or communication or partnerships we need to really be developing.
Supervisor, I'd just like to make a couple clarifying points based on what you said. I do want to clarify that on the on slide number, I think it's 5 or 6, which is disproportionality by race and ethnicity. The youth population for 2023 in Santa Clara County for Asian youth was 39%. The arrest percentage was 7% of the total population arrested was only 7%, and 4% were in detention or had been referred to detention. Those numbers are significantly lower than their white counterparts, even though they are the majority minority community in Santa Clara County. We have had some recent requests of why aren't you using Asian youth as the baseline? If we did that, we would actually have much more significant disparities for Latino and African American youth than we do than are presented in this report. But I also think that something here that would be beneficial for us to dig deeper in, and it's actually something I've been interested in for a very long time in my career here, is why is it that Asian youth are referred so less frequently to our department and by law enforcement than any other youth, than white youth? We know from historical research that ethnicity actually has no bearing on who commits crimes. So youth commit youth in this age group commit crimes relatively at the same rate as any other youth in this age group, regardless of ethnicity. And so what is it about the Asian community or the Asian youth that either makes them less likely to be referred, less likely to be environments where they're referred? And I'm sure that's something where we would love to work with you and your colleagues on the board to learn more about that.
Thank you for that clarification. And I want to clarify my comments and questions today is that data is important. It's critical. That's why we have these initiatives. But what are the lessons learned, right? What is the so what, or what is the so what to the data? What does that tell us? And Mariel, thank you for the clarification. But even through the clarification, now I have more questions, right?
Sure.
How are kids and across all ethnicities? Why and how are kids ending up in our system? Why do they come back with more referrals? How do we reduce the number of referrals? Or is that something that we want to do? What do we need to do? What investments do we need to make? And what partnerships do we need to have in place, or agreements that we need to have in place, right? Like, hey, classroom teacher, if this is something that you would not refer to a probation officer for any other student, you wouldn't do it in this situation here for this student, right? And maybe the education part here is that the consequences of your callous referral is driving someone deeper into a criminal justice system involvement. So it's like I really look forward to the stories and your interpretation of what the data is telling us, which then in turn informs our investments and policy decisions and how we show up in community. Because I also find that our community partners are eager to be partners in this, right? They do recognize there are places within our community where people recognize there are unconscious bias on their part, or they don't know how to approach or support a dually involved youth or a systems involved youth, right? In a way that would be conducive towards better outcomes. So I think that's the general question and premise. Appreciate the data. What is your interpretation of the data and the analysis of it?
Sure, and Supervisor, if through the chair, we present much more of that analysis at the Juvenile Justice Coordinating Council, where we provide information about the outcomes of various programs. We are required by the state to submit an annual plan and an annual report every year, and we actually look at our diversion program. 95% of the youth who go through our diversion program actually do not come back into the system within 2 years. So I think that there is, what we are doing for diversion is working, is what I would say. And our partnerships with schools and our partnerships with community-based organizations who serve the youth who are being diverted is working. And what we are now looking at is what's happening with those 5% of kids that are coming back, and what more could we be doing for that 5%. So that is an ongoing process for the probation department to look at what services are working, which are not working, and how are we then actually investing and supporting more of the services that we know work well. So for example, our diversion kids, a large percentage of them get referred to behavioral health services, which are contracted, or they get referred to community service learning. Again, 95% of those kids don't come back to the probation department.
They don't come back to the probation department, but then there is also this standard statistic out there that children, young people who are involved earlier on in life in the criminal justice system have a higher likelihood of being involved as adults, right? So with that type of baseline in adulthood, would love to understand. So, I mean, Nadia, you're a victim of your own success. The more you explain, the more questions I have, which is it's not a bad thing, right? If that's what we see as a baseline across the whole, but then yet our diversion programs are having this 95% success rate, how are we, I would love to understand for my own edification and for as purposes as a policymaker, how do we reconcile those two things to be true? And how does that translate into the work that we do here at policy? I hear you that you say that level of detail that I'm asking for is at another commission, but this is the policy-making body, you know, it's in the name, you know,
Yeah.
children, seniors, and families.
So we would love to come and meet with you individually and share more of that information, and then perhaps have further discussion here about how we could create that nexus between what you're hoping to do here with the information and the presentations that we provide at the Juvenile Justice Coordinating Council. 2 of the board members sit on that coordinating council and help us make policy decisions through that body as well.
I would appreciate that. And to the staff, I would welcome your observations, your assessments, your analysis of the data as this work continues to come back to CSFC. Even if it's just anecdotal, I think that would be helpful to shed light on what is the data, what is the stories that the data is trying to tell us. Okay, thank you. Chair, I have no more questions.
Thank you. That's a really interesting conversation. And we just heard the Latino health assessment, and it really is a lot of health indicators that, and where you live and the zip codes that you grow up in, the resources that are available or not available to you, and then the adverse childhood experiences that youth are encounter as they grow up. And of course, there's stereotypes that are very active in our community, stereotypes about who brown children are, who black children are, who Asian children are. And unfortunately, Latinos don't have the benefit of a model minority. They're just not given that benefit, right? And that's why I think you see a lot of low offenses being the first initial contact with the juvenile justice system. And that's actually one of the questions that I had is, what at the core of this is a lot of folks who are referring our children into our system through low offenses. What are some of the strategies that are being utilized that you think are really effective, that we should really, as a North Star, look to?
Are you, may I ask clarification on the question? Are you asking for once youth are involved in the system or before youth get involved in the system?
Before they get involved in the system, because I think that to Supervisor Young's point is, you know, why are our children getting involved? And a lot of it has to do with bias, right? Mm-hmm. Either law enforcement, teachers. It also could be, during the pandemic, there was an effort to reduce the number of law enforcement partners, not exactly law enforcement officers that were on site, but probation or subsequent type of officers, because a lot of folks felt that they were being over-policed, right? But then that leaves administrators determining what should be referred into the justice system, and so then it's a catch-22, right? Because now you have an administrator determining what is an actual offense if it's a fight, I think a lot of law enforcement officers obviously can tell the difference between something that should, an offense that can come into the system, an offense that cannot. And so I'm asking in the same kind of in the same vein, what are now that I've brought up some of the issues that I think, right, contribute to where our children are right now and make it even worse, what are some things that we can actually do? And I was actually, and I asked this rhetorical because I think for me, some of the things that, some of the energy that could be spent in investing in the kinds of trainings that allow for our law enforcement, our teachers, the folks in the community that are producing most of the referrals to understand what is expected developmentally for our kids, or what is the distinction between some of those offenses. Because you heard earlier about you didn't, because that was, anyways, the e-bikes. Yeah, you did. So the electronic bikes, or just the bikes alone, are going to be another reason why our children are going to come into the system eventually. Now they're going to get a warning, then they're going to get a citation, then they're going to get a fine, and I can see this ball continuing to roll in your direction for bikes, right?
Yeah. Something
that maybe other groups are not getting pulled into because of bias, because people don't understand that there is developmentally that's something that kids are going to be involved in, because there's like lack of resource, because there isn't a youth center in Gilroy, and opportunities to be involved. So for so many different reasons, right? And so what I'm looking for you to answer, or to help us shape and maybe integrate into the Latino Health Assessment, is how do we build some of those strategies, whether it's trainings or developmental information or distribution of the LHA or distribution of this data book. How can we get the information to the folks who are producing a lot of these referrals, and to the general public, so that they understand our youth in terms of where they are right now?
Sure. Well, I think many of the strategies that you actually just mentioned are ones that the probation department has supported over the years. Whether it's more bias training, training on adolescent brain development, and what does it actually mean to be a teenager, and what does it mean to push back on some of those items, and what is normal teenage behavior versus what is actually criminal behavior. I think that training is actually very helpful, and I'm not sure how regularly it happens for other law enforcement agencies. Probation is required to take to do 40 hours of training a year, and much of it is focused on evidence-based programs, on adolescent brain development, on bias, et cetera. And so, I know the state has passed a lot of laws recently on what types of training law enforcement officers need to take. I think that opportunities for, and I'll go back to actually the Latino Health Assessment, and what the young people told us is that, more opportunities for early childhood education and early childhood care are really important, because those build such strong foundations. We know children who go through pre-K and kindergarten have much better outcomes in school, which means that they have much lower likelihood of being involved in the justice system. I will say that we continue to work with schools and with districts on policies where they will not refer for certain types of offenses. We've had a long-standing relationship with Overfelt High School, where they've really implemented a sort of no referral type response for certain types of behavior. And actually, Santa Clara County was a bit at the forefront of that work before it became state law that you could no longer refer youth to probation for defiance, right? And you couldn't, and so that is now state law. You can't refer for those types of violations. On the e-bike situation, as you're aware, the Neighborhood Safety Unit had a bike awareness program at Elliott Elementary, I believe, in Gilroy. We're hoping to do more of those things with Gilroy PD and other other folks. In addition to giving away bikes during Christmas and Thanksgiving, we are also looking at doing bike safety events and teaching kids about appropriate use of bikes. I would say that a lot of those types of offenses don't actually ever come to the probation department, but I hear you saying that, like, yes, it starts out not coming to us, but it could eventually lead into something bigger because of an action that occurs while they're riding the bike, right? So, I think we appreciate and understand that it's important to be at the prevention end. Unfortunately, but also that sometimes is not the end of things where probation has authority or the ability to really make significant change. So we try to make change by piloting things and showing folks that stuff works, like the no defiance, no referrals type programming, which was also at the forefront of why you see less law enforcement in schools, right? We really listened to all the different research in the community, and we said, let's pick a couple schools and pilot this. And there's always pros and cons to that, right? Then the response is, well, now we have safety issues on school campuses. So how do we balance that? And I think that we're happy to be partners with you all in figuring out what the balance is and how do we work together.
Yeah. Well, I went to that event over at Elliott, and unfortunately, I think it was delivered I think it was well-intentioned, but it was like a 10 to 15 PowerPoint where, the officers were listing like state law that they were defaulting to, and it just, and these are elementary school age kids and parents, and so anyways, I just don't think it was delivered in a way that I think it could be appreciated. And I think that there needs to be, and I'll go back to the South County Youth Task Force for my opinions about what we should do. But much like in San Jose, that there's bike groups that help protect, help create events and things of that sort. I think that could be something that could be offered. And maybe we could talk about this offline, just so that I can continue to get your input about this. But I'm going to move on because I know that I can keep on this one. Anyways, it's a shame the way that our kiddos come into our systems, and this is one of the reasons why I wanted to bring this up, is that they're low-level offenses, and so I wanted to see from the kiddos who are coming in. Before I continue on, is there any way that we can get this report? I would really like to see this report come in before we make decisions on the budget for the year, because this is from last year, right? And so we're seeing this at the end of the year. It would have, for me, optimal to see it before we make budget decisions so we can continue to support our kiddos in a more significant and meaningful way. That means with our budget.
Unfortunately, this is, so usually September is the earliest we can have this. This was pushed to, I think it was supposed to be on calendar for October. It was pushed to the November meeting. That is because of the time frame that it takes for cases to be adjudicated within the juvenile justice system. So we need cases to be kind of done and finished so that we understand who's in our system, who comes out of our system, et cetera. And also it's a capacity issue. We have a variety of data reports that come not only to the Board of Supervisors, but are that mandated by the state. And while we have one of the largest research and development teams, it's still a very small team of people to do probably over 100 reports a year, some of which you don't see because you get pieces of them, right? So it's just a capacity issue as well. But it's also, the primary reason is that the data isn't available until late summer.
Okay, well, if there's any opportunity for us to, if there's any shift, if there can be any shift in the systems, and I know I'm asking you, like systems that may be beyond your reach and your control, but if there's any opportunity for us to move in that direction, one, I think this is something that our board in general should hear from, because, people hear about we're starting to hear more about the Latino health assessment, but our juvenile probation data, I think, is really important to inform us, not only about where our youth are going, but also how our systems are failing them, right? And I know here in the custody population that is dually involved, the data is very low. But I think it's low only because I suspect these children are older now. And the abuse might be different or may not be reported, right, for these kiddos. And so this, to me, is a failure of, and I hate to say it, but it is a failure of our child welfare system. The kids that continue to move on, we haven't prevented them. We haven't intervened in a way that prevents them from moving on into the system. Is a failure of our system. Is a failure of a safety net system for our children. I don't see it any other way. And so I'm going to go to page 16 on our juvenile probation data. I know that here we have the youth at first probation and child welfare welfare referral. And the average age for our kids to come into our child welfare system is age 5. And then we see them once again at age 15 in our probation system. What I was going to ask about this is how the dually involved youth is a program that we've developed, so we can shift it and shape it any way that we would like. And right now, it's very narrowly looking at probationers or youth that are in probation that also have an active case. And I'm going to say that because we don't have these active cases, we don't have dually involved youth, right? But I find that that most of these kiddos probably are not getting referrals into the system. And, you know, I'm just going to make my own assumptions, and I'm not going to put them out there, but our older kiddos are probably not getting the same number of referrals as our younger kids. And I know for our younger kids, even one of the prime ages is like 9 months old, right? This is the shift of a baby to a toddler. And those ages are a lot more stressful in nature for parents because they're caregiving in a very different way. How can we shift the dually involved youth program so that we can really take a look at the folks? There's a lot of kids who have had a child welfare referral and who are also on probation. Couldn't we shift our criteria so that we can qualify more kids into this program because it works?
We'd have to take a look at that. The program was actually developed with the court, so it's not just solely up to probation or DFCS to change the criteria of who's eligible. So the protocol was, if my understanding, and Wendy might actually have more historical background because I wasn't involved with this for about 5 or 6 years while I was at probation, but my understanding is that it was developed with the court and probation and behavioral health. So I'll refer to Wendy if she wants to speak more about the criteria.
There are certain rules and restrictions we have to follow, and the youth have to fall into one of those. So there has to be a lead from a court, either from probation or child welfare, and then there's some other parameters that they would need to follow. And yes, court is the one that makes that ultimate determination.
Okay, you know, I'll leave this alone, and I will probably create a referral around this. It doesn't sit well to me that we continue to see children involved in our child welfare system, and then they pop up again in the probation department, and we're just waiting for them. All right, I'm going to move on. I had a question about the offenses and the and why are our kids? If you can help me understand. Oh, I lost the. Of course, I lost it. there were kids who were detained until their detention hearing, and it was a significant number. It was like 71%. Why are they detained?
So, state law requires that we detain youth who have committed a 707B offense, which is essentially a serious or violent felony, in juvenile detention until a court can make a decision about whether or not they can be released. So, as you saw in the report, and let me find the page really quick.
But this is their case that they're waiting to determine whether they committed that 707.
Yes. So state law requires that probation cannot release them until they are seen by a court office, by a judge who can then determine if they are a risk to safety, public safety, because of the circumstances around their case. So if just give me 1 second, because this is actually a very interesting and complicated aspect of juvenile law. And I'm not a lawyer, but I have spoken about this on several occasions. So apologies. Actually, it's probably just easier if I go to the PowerPoint page that it's on. So on slide 10 of the PowerPoint, it's juvenile hall detentions. So 782 youth are brought to the front door of juvenile hall, correct? 656, so 84% of those kids who were brought to the front door of juvenile hall were detained by probation pending potentially their detention hearing. But of those, roughly, how many? Roughly 200 or so, a little less, 180, were actually released before their detention hearing. So sometimes between the point at which probation detains them and before their detention hearing, we're able to put into place a safety plan. So some of those kids may not be the ones who are mandated by state law to stay, but the 469 are likely A, scored very high on our risk assessment instrument, or B, committed a 707B offense and are legally mandated to be detained by state law. So the difference is usually the kids where we don't detain them to their detention hearing because we were having difficulty that evening, maybe finding a parent, and now we found a parent, or we wanted to connect them to Bill Wilson Center, or we wanted to connect them to a service, and so then they're not detained to their detention hearing. They are then released and given a promise to appear and to come back to court later. So we count anybody, and correct me if I'm wrong, we count anybody who's detained in detention longer than 8 hours as being detained.
Oh, got it.
So it's a time frame.
Mm-hmm. Okay.
Because a detention hearing is required to happen within 3 days, legally.
Okay.
I probably should have started with that. My apologies.
No. That's good. I also saw a decrease in the PEI program. Could you tell me what do you think is causing that decrease? Are we potentially underutilizing?
No, I think actually what's causing that decrease is changes to state law. So as you know, or as I think we've shared with a variety of folks, there were two major changes to state law, SB 439 and SB 1391, which indicated that probation could no longer serve youth under the age of 12 unless they had committed one of 6 serious or violent offenses. And SB 439 also changed who could be, and I might be getting these mixed up, but one of them also changed who could be adjudicated in adult law. So PEI in the last 5 years has decreased significantly because the number of overall referrals to the department has decreased because state law says that those referrals can actually be handled by the probation department.
Oh, I see. Okay.
So those are some interesting places where the prevention the work that people like the South County Youth Task Force, the work like the San Jose Youth Empowerment Alliance, they are sort of filling that gap, as well as a partnership with DFCS, with behavioral health, with community-based organizations, because there's a number of kids, probably between the ages of 11 and 13, who are no longer coming to probation, but that doesn't mean that they have issues.
Right.
Or that they don't have issues.
Do you track at all some of the reasons why some of the youth are not completing the program, or the barriers that they? Yeah, you
Sure.
are.
We do, and we present that in our Juvenile Justice Crime Prevention Act evaluation. So if, I don't know if Kim can respond to that today, or we could get back to you with just some
Yeah,
information
we can do
later.
that offline, you know,
Okay.
and have a follow-up meeting about this. The reason and some of it I'm also asking because as things have been progressing in Gilroy, I'm trying to figure out what lessons can we learn and take back to the South County Youth Task Force? I know there's a lot of folks who are in the JCC that are also in South County Youth Task Force, and I'm sure that they were taking those lessons. I just want to be very sure to just put a check mark after it. Okay, and is there a way that you can also give me some of the information in terms of the referrals that are coming in from from South County, so I can see them? Because I know that overall, I understand that there's some low-level offenses, and I just want to understand those numbers a little bit better.
Supervisor, on starting on page 29 of the report, I believe, or it might actually be page 28, we have an appendix. Our staff would be happy to meet with you and your staff to talk
Perfect.
about the data related to South County.
Oh my gosh, yes.
Yeah, because we do have about 4 or 5 pages on data specific for South County.
Yes. I think overall, I understand that kids are coming into the system at a lower level offense. And even the restorative justice folks had shared with me that they were surprised to see some of the reasons why our kids are coming into the system. And this is what at the root of it is bias against children of color, or an intolerance, or a need to punish or be punitive, instead of embracing our kids. Obviously, this report also shows the anxiety and emotional need that our kids have, the principal service needs for males and the principal service needs for females were emotional factors, and we are not matching up what we know to be plaguing our youth with what our systems need to do. And so that's another issue for our behavioral health, which I'm happy to pursue. And I've already made a request to follow up on that. All right. I think for me that is it. I do want to also offline talk about those emotional and relational factors that are influencing our kiddos, and how we can, within our own systems, do something about it. Maybe the other systems we can shift or shape a little bit slower. Our reach is, maybe we can't even have a reach in there, but there's always a potential to just connect all of these dots for all of us, and so I appreciate this. All right. I don't think we have a, nope. We don't have a motion just yet. Hoping we can get that.
Motion to receive report.
Awesome. And then Camille, take us through it.
All right. So that's Vice Chairperson Young
Yes.
and Chairperson Arenas.
Yes.
Thank you. Motion passes.
Perfect. Thank you. We're going to move on to item number 6, which is receive report from Social Services Agency relating to the progress of contract and procurement operations. Welcome.
Good afternoon. George Montes from the Social Services Agency, Office of Contracts Management, here to respond to any questions you may have.
Wonderful. Is there anybody in our public who would like to speak?
We do not have any requests to speak.
Wonderful. I'm going to look to my co-chair for comments and questions.
Thank you, Jorge, for the report. I just want to make a comment. Just there's the inventory of programs that support children and seniors. The prolific volume that came from Supervisor Simidian. I know he's not here, but just wanted to make that acknowledgement that there's some very innovative low-dollar contracts and investments made here that make great impact in a community that can be overlooked because of, like what was referenced earlier, myths, right? Model minority myths or beliefs that lead to poverty being camouflaged amongst affluence and possibly left for greater harm in the future. And I really, I don't know if that conversation could happen here today, but something that we, as we move towards our budgeting process, the years ahead of us of budgeting challenges, and in light of the referral discussions that we had the board meeting earlier this week, is just that how do we think about these opportunities for relatively low dollar investments that make great impact? I know that's like the magic formula that we want to pursue, but being able to even intervene in a way that lends itself to greater prevention. Jorge, I know you're the contracts, the numbers man, but having gleaned through all these contracts over the years, right, and seeing the outcomes of it and then coming to this committee to present on it, that's something that I would love to explore with you and also with your office in terms of what opportunities we have to shore up and cover, gaps in services before it becomes significant. And what I really appreciate is just the amount of investments made in seniors that has yielded really great results and outcomes, and which of these contracts, which are discrete in of themselves, should be scaled up as we hate using the term silver tsunami. It's a weird term to me, but I know it's what it's trying to say, right? In about 5 years, our largest demographic is going to be the elderly aging population, 5 years ahead of the rest of the nation. And that's something that's top of mind to me. As I was reading this report, that really was what jumped out at me.
Thank you, Supervisor Young. Certainly, we are always open to coordinate with the board offices and the CEO, other members of the community, on what is best for the future and how to address gaps.
Supervisor, I was just going to add, and I see Vanessa Merlano has her light on, so she can add as well. But Dan may want to weigh in here because consistent with the comments you just made, one of the efforts that I know is underway in the Social Services Agency in preparation for what will be a very challenging budget season is really a mass effort to go contract by contract by contract across the entire agency and make sure that we're really doing the best possible assessment, given also the volume of contracting work that's happening through the Social Services Agency, to really make sure that we're prioritizing for preservation just those sorts of investments that are really yielding a super effective return on investment. We know that sometimes actually if we get people just the right services at the right time, we can stave off a whole cascade of really challenging needs that later can arise. I know that's kind of part of the theme of some of the conversations we were just having about how do we avoid youth ever entering the juvenile justice system, for example. But there's a big effort underway, contract by contract, and actually one component of that, and I'll just take this opportunity to say that I think a bunch of us neglected to flag when we were on the consent calendar that actually item 7, which I know the committee agreed to let us push forward 1 month, is really part of an effort to try and bring forward to the board well in advance of budget really robust and detailed information around some of our contracting efforts, and we wanted to just do a couple more additions to that report so that we would be able to bring it forward in a really fulsome way for it to be used for exactly the types of sort of pre-budget thinking, planning, and conversations that we know need to be happening both at the department level, at the committee level, with the full board, so that we're walking into what will be some really difficult choices with a much more holistic picture of what we are currently investing in across a lot of service lines.
Thank you, Greta. And what I'm gleaning from that too is exactly kind of at the core of my question here is that how do we make budgetary assessments within the context of the future expenses that would have to be incurred if we don't make this minimal investment now. But when we're when we have a budget shortfall north of $1 billion, every amount, no matter how nominal, feels like a significant amount. Vanessa?
Yeah, thank you so much. Vanessa Merlano with the Department of Aging and Adult Services. So I appreciate your question, Vice Chair Jung. And just to piggyback on what Greta said, I think one of the things that we've discovered is that, to your point, there's a lot of incredibly impactful work happening. And the department has been doing a lot of work to work with our community partners to develop how to define the impact of that work. And one of the ways that we've been doing that is through collection of logic models. And I was just having a conversation with our Office of Research and Evaluation today around these logic models. And I think that a big component of utilizing those logic models in a way that has the best impact is bringing along our community partners. And I think that we really need to start having additional, more deeper conversations between internally how to build capacity in our community partners on how to best utilize those logic models, how to best render outcomes that help us build upon the work that we know is already established and strong. And we at the Department of Aging were willing to be a partner initially with OCM and with the Office of Research and Evaluation to start to develop that training in the next year, because I think it's going to be a big component. We need to be able to define how we impact the community, and part of that is developing that in partnership with our partners. And we're, I think, ready to do that and need to honestly double down on that, because the storytelling is going to be what's going to get us to the next phase.
I really appreciate that, Vanessa, and I realize that the hard coordination of our work, right? There are mitigations, low dollar investments, when put in context, that could stave off significant harm in the future. But then at the same time, like, that's so necessary for us to be able to focus. It creates capacity too for us to be able to focus on, like, the really big burning fires, right? The extreme disparities that we don't have to wait a few years for the harm to be fully realized. The harm is right now. So I also want to just acknowledge and recognize, like, the delicate balance of all these different initiatives across a very large geographical footprint of a county. I look forward to more conversations, and I feel like there's going to be, Jorge, we may be calling on you more often, both online and offline, just as we continue to head towards our budgeting process. But thank you for your work on this report. And also thank you to my chair for requesting this report. All right, that's it for me.
Thank you. You bring up really good points. I was thinking about them as you were speaking. I really like your guidance, Greta, in terms of this, the future next steps for this. I had my own recommendations on this. I would like to have a level of alignment with data, especially with data that tells us what has been happening to those folks within our systems, whether they're seniors or whether they're youth, or our families. I think we've heard in an earlier committee about, and previous committees and in our board meeting, that families are more impacted by homelessness than in other times. And so things are shifting in terms of the needs of our families, and I think our services and our programs need to shift just as well. And so when you're talking about the logic models, a logic model is going to tell us whether that's the most effective strategy to deliver, or the way that is the best way to deliver that service that creates that kind of outcomes that we want. And I think that can happen for any program, but what are the programs that we are utilizing to actually create alignment with the data? Because I can pick any favorite program and we run a logic model on it, but are those the programs that we actually need in order to address what we are finding to be true in our data? And I'm going to say that we need some work done in that area, because our kids continue to shift from our child welfare system into our probation department. And not to say that any of those two departments are not doing their best in terms of addressing the issues, but there's obviously some need or gap or more strategic alignment between the two departments. And I'm going to go back to the STRTPs that we wrote a referral about. It was the very first time behavioral health and DFCS were working together on this item, which I think to me really creates those kinds of shifts that we need in our systems. And so I think this is just a sneak peek into how we are investing our money, but is this the best way to render the kinds of outcomes that we're looking for the majority of the folks who are in our safety net services? And so I don't think it is. So anyways, maybe offline we can connect and discuss this a little bit more, because I do think that we need to be very strategic and understand what are the tools that you're utilizing to help us make those determinations and those recommendations. We all need to be on the same page and use those same tools and same data. And I agree that we have a large senior community throughout all of our county, and who already, what is the data, but what is already provided, right? And that kind of asset mapping is important, not to recreate the wheel, but there's already services that are being rendered, but are those services the ones that should be happening in the places that they're happening, and are they going to render the outcomes that we want? And sometimes I think it's a hit and miss. And then the next question for me is, how do we shift and how do we reinvest our resources in order to line all of that up, to line up the data, to line up the assets, and to line up the response to those two things?
Supervisor, I'll just briefly respond by saying I'm actually really gratified to hear some of the issues you're raising, because I think they are consistent with some of the conversations that are happening on amongst the different departments and administration. Just to give you a flavor for that, I think one of our challenges, as we've talked about in a couple different committees and contexts, is we've done a wonderful job as a county organization of funding lots and lots of different programs and services that often are being used by the same youth, the same families, the same elders. And so we'll report out on outcomes for a program for the folks that use it, but are the good outcomes or the bad outcomes we're seeing being driven by what that program is doing or not doing, or is it actually a result of other things that we're doing for that person? Some of the what we know would be the sort of truly rigorous evaluations of our programs are themselves so costly that they cost as much as the program itself. So we struggle, as do other organizations, to figure out how to strike that right balance between investing a ton in our programs and also doing quality evaluation, trying to figure out what outcomes are being driven by which programs a particular person may be using. And I think one thing that we really need to do, and I think this really difficult budget time is going to give us even more incentive to do. We were just having a conversation about this yesterday in a meeting that I was in with Vanessa and Dan about, at what point do we actually think it's not serving us well to be enrolling a particular individual in about 6 programs? We might need to consolidate that down, and we've had the same conversation with kids, into 1 or 2 higher touch, higher quality interventions, or there's 1 or 2 staff, either of a CBO or of the county, who are really focused on more holistically meeting that person's needs. And that's a painful transition from a structure that we've built over years, where we've added a new program that really reflected what might have been a key focus area or a key need in the community or a key idea that someone really wanted to carry forward. But I think at this point, given the need to contract our services and exactly that critical policy perspective that you're articulating around how do we make sure we're getting people what they really need in the place they need it, at the level they need it, is going to require us to really rethink some of the ways that we've organized ourselves and are deploying our resources. And so that's definitely a lens we're asking our departments to view things through. We're also really making sure we're not kind of duplicating the same programs, but at a low level in a couple different departments, and maybe providing one more well-funded, more robust version of a program that may be more effective. But those are complicated endeavors, and also ones that are likewise complicated to succinctly summarize and present, which I know will be a key area of focus for us as we try to also make sure that the board is robustly informed about what analyses have really informed some of the proposals that will be brought forward during the budget process.
Yes, thank you. I think I'm just going to say it. There's pet projects for our supervisors, and it's very obvious here in some of what is reported. First of all, I don't know why we're in transportation programs, why we're investing when we can have advocacy through VTA to render some of those services. Anyways, I'll just make that comment, but I'm really focused on making sure that the data, that we line up with the data, and I don't think in years past the way that investments have been made throughout our district really correlates with who's in our safety net services and who is overwhelmingly still in need of those services. I think there's too much of pet projects that have been happening, and so I am really embracing this idea of making sure that our data, our assets, and our response plan is lined up. And so I'll ask for a meeting offline with you regarding this, and look for a motion on the item.
Motion to receive report.
And I'll second that and look to Camille.
Vice Chairperson Yung
Yes.
and Chairperson Arenas.
Yes.
Thank you. Motion passes.
Thank you. Okay, we are going to move on to item 7 that I realize we did not defer at the beginning of the meeting. And Michaela, if you would help us, I think what we can do is make a motion to defer the item. And I don't think it has a date set, just a motion. And I don't know if making the motion creates an opportunity for us to also hear public comment. It does. Okay, so I'll make the motion to defer item 7 to a future date determined by administration.
Second.
And then I'll ask Camille to check for public comment on the item.
We currently do not have any requests to speak.
Perfect, and then you can just take us home.
Okay, Vice Chairperson Yung
Yes.
and Chairperson Arenas.
Yes.
Thank you. Motion passes.
Awesome. Okay, we are getting to the end of this almost. We are going to go to item 8, which is receiving the report from the Department of Family and Children's Services relating to the Child Welfare Correction Action Plan and related reform efforts. Welcome.
Good afternoon, Supervisor Arenas and Supervisor Young, Wendy Canarauch, Director of Department of Family and Children's Services. I will just provide a brief highlight today with some exciting updates on stuff, but I'll try to be brief today. So I know my counterpart is pulling up the presentation. And you can go to slide perfect. So one of the biggest things I want to bring back is that we had arranged with California Department of Social Services to bring back a mid-year review on how we were doing in the corrective action plan. They were on site on October 7th and basically did a mimic of what occurred to get us in this corrective action plan. So they pulled 55 referrals and cases using the same methodology that they reviewed our cases last time, and then did individual interviews and focus groups. I am happy to report there was some great early successes and highlights in this process. All of the referrals and cases that they pulled showed great improvements in utilizing the structured decision-making assessments, showed great results in showing safety plans, documentation of safety plans, and appropriate escalation when necessary of those cases. There was also feedback from staff that they really appreciated both the coaching opportunities and small group trainings and monthly updates on the CAP to know where we were at in this progress. In the areas of opportunities for growth, they wanted to continue to ensure that we do good documentation of the monitoring of safety plans that we've talked about here in this arena. Staff really had concerns about the significant amount of training they needed to do, and just really acknowledging this was a really heavy lift in the last several months of training that staff needed to do, and really wanted to have more small group coaching and feedback loops for how things were going, as well as expressed how do we handle disagreements between cases. Happy to report we took that feedback very seriously and are weaving that into items that we need to do right now. So just a brief snapshot of where we are. We have passed the 50% mark. We're at 55% that we have completed, another 37 that are actively in progress. So we are well on our way for the 75 action items. Many of those are around our policies and procedures and are heavy lifts that are very tedious and will take us into June. Next slide. Just a couple areas that I want to update here. In the area of safeguarding children, the big one I want to lift up is that we have actionized our safety tools and our for our child and family team meetings. So there's observations happening for families in child and family team meetings regarding safety. We have one of our external coaches who's doing those tools. So we'll be bringing back that feedback later in the year, as well as our risk assessment tool, which tells us after we assess families, what level of risk are they at and what's the recommendation. So we'll be taking a look at quality on those. In the area of building key partnerships, I know this is one very near and dear to your heart, Supervisor Arenas. We have actionized the community pilot. We are live in Gilroy. We have worked with technology services, and phone calls go directly to that social worker. We had to work through some items to get that person on site. I believe that's been worked through, and they will actually be on site as of next week. And then for Franklin McKinley School District, we'll be launching in November. And then just want to lift up in the area in our partnership around staff development and support. We've worked with technology support services to move a couple of our trainings to be e-learnings around the legal consultation training and then around our critical incident report training. And we did this in partnership with CDSS as well. Just got feedback on Monday from CDSS that they actually are going to use that training for possibly other counties as well. So our good work that's occurring in this county may be shared by others. And then the next slide is just a reminder about our child abuse reporting. And then the next slide I just want to lift up because I want to use every forum for the ask around the need for caregivers in our community, given the number of children that are placed out of county. We want kids to stay in county. We want them to stay in their home schools and in the communities they live and play and grow up in. And so really an ask to community for the need for caregivers, specifically around siblings, and for those in community who may want to learn more about our highest acute youth and the wonderful training and support that's available for those that want to step up into that arena. And with that, I'm happy to answer any questions or clarify.
I'm going to start with our public and see if there's any input.
We have one request to speak online.
Okay, I will do 1 minute.
1 minute, okay. So let me just adjust the timer. Thank you. So our speaker is Parent. Parent, you will have 1 minute to speak. Please go ahead.
Yeah, I mean, I don't see any improvements. I mean, if I have to come here meeting after meeting and beg for a screening, I mean, that's an issue. I mean, like, part of the problem is that we're lowering the time for public comment every time this child welfare reform comes up. I mean, I think that's wrong too. But in any case, I mean, I've been going to the Child Abuse Prevention Council meetings, and it seems to me that almost every time I go, it's almost expected that Wendy Kinnear-Rausch gets a round of applause. And I mean, she shouldn't be getting all this praise. I mean, it's unconditional. She's not doing a very good job. I mean, if she's letting my kids get molested, then she's not doing a good job, and she is doing that. And I don't understand why she's throwing my kids under the bus for two people with connections. I mean, is it just as a favor? Is it corruption? Is it callousness? I don't know which one of these three things it is, but it's certainly one of these things, and we need to get to the bottom of why Wendy Kinnear-Rausch is failing. We need to get rid of her. Thank you for your time.
And that concludes public comment.
Thank you. I will look to my co-chair in case she has any comments. Yay.
Wendy, I want to thank you for your work on this. This is a significant amount of work. It's an iterative process that we continue to go through. I think my first introduction to CAP was in 2013 when I first started working here. So I don't have any questions today for this discussion except to express my appreciation. And the fact that our offices continue to communicate and connect with each other on updates. So I'm good with it. I'll just preempt with a motion to receive report, but I'll turn it over back to Chair.
And I will second that. Overall, I'm just really happy with the progress. When my office developed a referral for the work plan, it was something that it pained me to do, but at the same time, it was something that needed to happen. And you've all been such great partners. I really see you yearn to ensure that our staff is where they need to be, not only for their own well-being and for our performance, but really for our children. And so I just was really also touched when we had our reunification day. And you're a mom, Wendy, and yet you came back from your son's graduation, college graduation, which was a very great distance to come back and celebrate with everyone, and just to, at the very least, create a little bit of contact and closure with them. And so it really tells me where you're at with our kiddos, which is where we all are, of course, with our kiddos, and that they are in our hearts. And so I'm really impressed with the completion, the more than 55 or the 55%. I think that's amazing. And I think that there's an opportunity for us also to continue to improve our systems, because it'll never be perfect, right? There's always going to be an evolution of them. I hope we will always have evolution of our systems and be responsive. Our systems need to be nimble that way. I wonder if there's an opportunity for us to create a way to capture feedback from our social workers and our staff, our clerical, for some qualitative data, something that can kind of tell the story of progress, and maybe or stagnant circumstances for some folks, because I can't speak for everyone, but we need to capture everything so we ensure that that the process is working for everyone. Is there an opportunity for us to do something like that, or you're already?
No, absolutely. And I'll highlight that it links into the feedback, and it also links into our corrective action plan deliverable around having a communication plan. And we actually slowed that down to roll it out in order to make sure we're being thoughtful in feedback. We'll be meeting with several of our employee affinity groups across the department that are very passionate and staunch advocates for the work with families, as well as our steering committee that serves as kind of an advisory and has staff at all levels, just as the starting place on our draft communication plan, and to get their feedback on how we do these feedback loops well. And as you said, this is an iterative process, it's a fluid process, but we also want to make sure that what we are building out can be sustained for years to come and continue to serve well.
Perfect. And I heard you say also that you're also going to brainstorm a referral disagreement process, and that's really good to hear, because you're anticipating, of course, we're very distinct people, and there might be difference of opinions, and so that's really great. I wonder if we can have a meeting offline so that I can also contribute some feedback that I've heard that can be left to offline follow-up. And so the last thing I just wanted to, and thank you for slowing down the communication plan, but I would love to see what that progress is. We can talk about it offline as well. Those affinity groups are very, they do have an affinity to our youth, and also I think sometimes we have some expectations and dreams and hopes of what we hope to accomplish, and then there's the reality of what our system has the capacity to do. And if our system needs to continue to increase capacity, then that's a question for all of us to answer and for you to lead in. But I love that our affinity groups are always creating questions and pushing limits, because I think that's part of making sure that our systems continue to work, right? These questions that they bring up. Okay, so I'll give you some time for those communication plans to roll out in a way that is meaningful. But I would like to see on an ongoing basis what we are doing for our kiddos and for parents during stressful times. Those campaigns that I think we have had throughout the year already that you've released messaging around, but I know that holidays are extremely stressful for everyone, and especially families, and we have seen in the last month information regarding our families and the number of them who are unhoused and the number of them who are sleeping in their cars, and the kinds of accommodations or messaging or access to different kinds of services that we can offer, so that our kiddos don't touch our referral systems. I'm really happy to see our pilot program up and running. I know that there's also an opportunity for us to clarify in terms of communication plan, clarify what our social worker is meant to do and what they are not. There are SLS coordinators on site as well, and so I think in general, for the general public, that SLS is there for those kinds of connections. And I wonder what that work looks like, and we can talk about it offline, how those two folks are interacting and providing services, as we've seen not only in the probation department, but in the Valley Homeless program, that they did screenings on our children, on our youth, and there's a lot of kiddos who are depressed, yet the connection to the services were very low, just extremely low. And so that tells me that we need to also continue to think about how do we make those connections, and how do we work with behavioral health to ensure that those kiddos don't progress because they don't have because we don't have the infrastructure to offer them services. It is almost cruel to me to ask them and to screen them for depression and then not connect them. And so would love to have your support, and I know this doesn't belong to you, but it is our kids, our shared kids that we have here, and I know it's our health and hospital systems, and then it's behavioral health in particular that we need to make sure that we all connect. But these are kind of the same kiddos, right, when we look at the programs. Anyways, that's the conversation that I wanted to have with you, and then we'll take it offline. And I'd love to hear your feedback in terms of what you think, how we should connect all of these data points for the well-being of our youth. All right. We already have a motion and a second on this, and then Camille, I'll ask you to do the final.
Okay. Vice Chairperson Young?
Yes.
And Chairperson Arenas?
And I'm going to say yes, too.
Thank you. Motion passes.
Perfect. Okay, guys, we've done it. We've done it again. We are just at the end of this, and we're only in announcements. This is item 11, and these are our department heads or representatives who are here, who are going to give us a little bit of an announcement, and then we'll hear from our public collectively, and then we'll be done. Who wants to start?
I can start. Good
Dan.
afternoon, Chairperson Arenas and Vice Chair Young. Daniel Little, Social Service Agency Director. First is our Office of Family and Children's Policy in partnership with Kids in Common and the County Office of Communication and Public Affairs. Recently completed a flyer with information about HR 1 funding and the impact to families and children in our county. So it's something we'd be happy to share with both of your offices. The Department of Aging and Adult Services is hosting its Senior Agenda Summit on December 4th on the topic of intersectionality on aging. Looking forward to the event and the community discussion, as Vanessa pointed out, that in community engagement is so important to that work. Tomorrow, on the 21st, Wendy and the Department of Family and Children's Services team joins the Superior Court to celebrate Adoption Day 2025. The event honors those families who have opened not just their homes, but their hearts to children in need of love and belonging. And finally, I just wanted to give a personal thank you to both of you for the work during our recent CalFresh crisis, where we had 133,000 of our residents go over a week without any food benefits, and the messaging that you both helped with to get the message out, along with our agency staff, were able to confirm that they connected with 97% of those beneficiaries directly to make sure that they were all connected and knew kind of what was going on. And while we never want to see something like that again, I think we have learned from that on how to quickly pivot to offer additional resources and do additional communication. So something that I wanted to pass on to both of you. Thank you.
Yes, go ahead. Yeah, I just want to thank you for bringing that. I really want to thank you and your team. I know that y'all worked around the clock really early in the morning, late into the evening to make sure that each of our CalFresh, as many of our, 97% you said, as many of our CalFresh clients as possible received a direct touch from our organization. I actually got some feedback from some of my constituents saying that they were never in the dark. Our social services staff reached out to them, checked in on them, and that your frontline staff was also providing resources to other food security programs as well. So I just want to say thank you for that, acknowledge that. So I don't expect the whole county to be watching any of our meetings, but I shocker. Gotta raise my standards. But I hope that if there's anyone listening today from your operation, that the work did not go unnoticed, and it made a big difference during times of massive uncertainty to hear some certainty and to hear that someone reached out to check in on you, to just make sure you're okay. Thank you.
Yes, I'm going to add to that because I think it's really important when folks ask you if you're okay, if you need anything, right? That's a good neighborly thing to do. And so that's wonderful to hear that you connected with 97% of our participants. It's amazing. And it's very touching, right? And so I'm so glad. Can I ask you, out of those participants, how many actually had the need, or were they okay? How did that go?
That's a great question, Supervisor. I actually don't have that information. This was more making sure that people understood what we were doing, where they could go for the food banks, and also when we got benefits reloaded to make sure they were aware of that.
Yeah, I was also really impressed. We and my team members thought of an idea to bring in Community Seva. Many of you who are familiar with Community Seva, they just do a really great job of putting together meals in large scales to our community. And, our resident, that he lives in my district, and so we're very familiar with him and just does a really great job. We've provided funding for him. And he, in the past, and so that he actually went out to Gilroy, and I think in one weekend did about 800 meals. And so that's the reason I was wondering if there was still a need, because I thought, well, the benefits came back online rather quickly, but there was still that need for our kiddos and our families. And so that's the reason I asked that follow-up. And they're going to continue to do that. It's going to be 3 weeks and 3 weekends in a row, or Saturday and Sunday. This is not even during the week. This is Saturday and Sunday, where they're going to offer the same service for our families. And I think it's going to be consistent. And so to me, that's a little scary to know that our kiddos are still in that need, even though their benefits are back on, right? So yeah, it's a symptom, obviously, of poverty, especially within under-resourced Oh, Greta.
Supervisor, I really appreciate you flagging that, and I wanted to just say a couple of things about the amazing effort by the county in the context of this really wrenching situation, and to thank Dan and the entire DEBS team who are not here today, who were literally up in the wee hours in the morning going beneficiary by beneficiary to see if people's benefits had been turned back on as expected. And they actually flagged a key issue for the state that in the initial round of benefits being turned back on, they were on for folks who'd been on CalFresh before November 1st. But if you were enrolled in CalFresh on or after November 1st, that really brand new group of beneficiaries weren't initially in the group whose benefits had been turned on. They flagged that for the state. It got resolved statewide in part by the diligence of our staff here. But I also wanted to highlight the other issue you lifted up, which is I actually learned a lot as we all did a deep dive on responding to the emergency associated with the termination of CalFresh benefits access, just how many folks don't qualify for CalFresh who are food insecure in our community. And so I really want to thank the leaders at Second Harvest, who, as you know, work with so many community-based organizations to leverage this kind of centralized purchasing power to get a lot of organizations who do wonderful work deep in community access to some of the food resources they need to bring down the cost for delivering food at scale. And they shared that even apart from this struggle with CalFresh, they're serving more folks than we serve through CalFresh, 130,000 in our county. They're serving, they're providing food support to 343,000 folks on top of that on a regular basis in our community. And as we see fewer folks qualify for CalFresh, as we see some of the impacts of HR1, that need's going to grow. And so I feel really gratified that we have a team that's really laser focused, not only in DEBS on how do we make sure every single person who can enroll in CalFresh is enrolled, but also looking at broader issues around food insecurity through our food systems work plan, and really connected also to how do we support local farmers in our community who can also deliver really high quality food to folks who are food insecure, because we know not only are folks who are food insecure needing more food, they're also often consuming really low quality food that's contributing to poor health outcomes. And so also trying to really make sure that all of our efforts are designed not only to meet people's basic need for nutrition, but at a really powerful level. And also want to lift up some of the amazing work our senior nutrition does. And Vanessa, I know this is the hugest area of passion for her. So we're really lucky to have many incredible leaders in the county organization who are laser focused on this issue.
Oh, I'm so glad. It makes me really proud to know that we are the ones who are catching things and making sure that people statewide are getting their benefits. And so congratulations on that. That's a really great catch. The other thing that I wanted to differentiate on maybe what I think I see in Gilroy, but I really would need more data from all of you to figure out how many CalFresh or SNAP recipients are in Gilroy or in South County. Because what I'm wondering is, on top of that, there's a layered challenge that our families are facing, and that is that they're unhoused, right? And so I was thinking maybe it didn't really matter whether those benefits came back online or not, because if they're not able to cook, right, they're not able to get it from Second Harvest Food Bank. I mean, fresh vegetables are only, there's only so many salads you can make, and I know kids are, if they're anything like mine, will fight it as long as they can. But the number of families and people that came out for a hot meal was astounding. It was just astounding. It was like 300 on one day, 500 another day, 500 another day. It was just, and so anyways, I want to put my finger on it, and I don't want to make that assumption, but it kind of lines up with what we've been hearing this week about unhoused families, and the unhoused families are spending, obviously they're in their car, and so, limited opportunities to cook. And so I was thinking, one, how do we access or increase that access? And Greta, there's these, I think it's, oh my gosh, what school is it? There are these containers where they, I think this is in Morgan Hill. One of the schools, one of the high schools are doing these containers where they're these walls of like lettuce and vegetables that are, that you pull out, and they produce so much lettuce and vegetables that they actually produce all of the salads for all of the high schools. And not only that, the whatever is overrun on that, they have it for one of the wineries has their own restaurant, and then for some of their salads. So I mean, it renders quite a bit of fresh vegetables, and I wonder if that's maybe something that Casey would be able to follow up on. It's just a model, I think, that is very inexpensive, and it's ironic that it's in Morgan Hill, where there's a lot of land and a lot of farms out there, but they're doing something very innovative with their container salad production. Yeah.
I'm sure she'd be really happy to look into that. I think there's a lot of really fun and innovative ways that schools are trying to kind of entice kids and interest them in a broader array of foods, and also actually see a kind of a career path in a lot of this work. And so I know she would be, if she doesn't already have this on her radar, very interested to look into it. And I'm aware of a couple really amazing, innovative school-based food programs in your district. So I think we're really fortunate to be in a position to continue to grow some really special work in this vein.
Yeah, I'll just say the NEEDed program, NEEDed with the KNEAD, because they do pastries and stuff. They elevate and profile some of the kids, and they're the main speakers at some of the fundraisers. And I'll tell you, most of them that I've heard are recipients or are involved in our child welfare system or in our probation department, right? There's kiddos who have gone through some really just difficult issues, and are still trying to create opportunities for themselves and take advantage of the programs. And it just really warms me to know that we are supporting programs like that, and that our kids are turning themselves around, especially with food, right? It's so comforting. Food, it can be very comforting, especially if you have it available to you and you're able to cook it and share in a family unit. So anyways, I just thank you so much. I know we spent quite a bit of time on this, but I think it's worth it to have these kinds of conversations. And so thank you, Dan. I'm going to move down to see who else wants to give me an update.
Can I just offer a quick addition to that? Daniel, thank you so much. Daniel mentioned that the Seniors Agenda Network Summit is on December 4th. It is on intersectionality and aging, and it's a really topic that has been very interesting to folks. So if we don't know, it's really... it recognizes that people have different experiences based on overlapping identities, things like gender, race, socioeconomic status. It is sold out. Peter Esteniel reached out to us this morning, Vice Chair Jung, to see if he can get on, and we have added him. And so Chair Arenas, if you have a staff that's interested in joining us, we have 200 people convening in the Campbell Community Center to hear about this. And we have a panel of community residents that represent the disabled community. We have someone from Parents Helping Parents who has a child who is disabled and caregiving, and we have somebody coming from the long-term services caregiving space as well to give their testimonial around their experiences. So we really do encourage for your participation, and if anybody is interested, we're happy to lift some of the wait lists to allow for you all to come.
Of course, thank you so much. I'd be willing to just sit in the bathroom and listen it from there. and also get away. Bathroom sometimes is the way that you get away from, at least my kids. I'm like, don't look for me. All right. Well, this is getting out of hand now. All right.
I'll go ahead and go. Don Simone, Child Support Services. I just want to take a minute to recognize our Veterans Services Office. As you guys might know, a couple weeks ago, they hosted again the annual Stand Down event, and Child Support got to participate this year in that event. And some of the folks that came back that participated said that that's the first event that they've attended it was a very emotional event for them, and mainly because they were watching a lot of the veterans and how much some of these services they were getting meant to them. Everything from legal services to health services to haircuts that were free. And they just felt like they really were making a difference in the lives of some of the veterans that we serve. So kudos to SSA and to the Veterans Office, because it was a really good event and our staff loved participating.
Oh, that's awesome. That's awesome. Thank you so much for sharing.
I have a question about the stand down event. Fantastic event. I wasn't able to make it to the opening ceremony, but I was able to swing by just to observe, kind of almost not trying to be a secret shopper, just wanted to be non-disruptive, right? The benefits enrollment, that was packed, jam-packed, and I just would love to just glean your thoughts on how that went. Any thoughts about improvements in the future? That's so critical, especially as we head into the full expansion of HR 1.
So I'm not specifically, I don't know exactly how the benefits went. I think Daniel could probably speak to that.
Yeah, thank you. That was a great question. And we had over 160 veterans that were able to get their full benefits process there. And just a reminder, of going through the traditional process, that can be 9 months to a couple of years in general, because you have to go through the VA and it's the full medical before you can get the benefits. So over 160 that'll get their benefits immediate. So it's a huge thing, something that we're still trying to work with our federal partners to see how we can make that kind of a more standard process instead of a once-a-year piece, because it is such impactful on these veterans.
And I really appreciate the pairing of record clearances too, to make sure that there were no barriers to being able to enroll in benefits, especially for our veterans. Yeah. Thank you for the shouting out the staff. Thank you for that update. Really a heartwarming and inspiring event, and I feel like something we should do more of.
What was that number, Dan?
160.
Wow. Yep. Okay. Awesome. Congratulations. And last but not least, and looking to my left, Maria.
Yes, just one quick announcement that we're really grateful to our staff who will be using our mobile vans next week to deliver Thanksgiving meals to clients and families from adult and juvenile probation, and specifically also some of our homeless clients. So, this is something that our staff often does unrecognized, and that they take upon themselves to organize. And so now that we have our mobile vans, they're able to kind of transport things a little bit easier, and it's just a really great thing that comes from our staff.
That's amazing. Thank you so much. I hope provecho to all the families, and thank you. Let your team know that we are really grateful for when no one's looking. Those are the things I think for me that really matter, right? Or some of the events where you're facilitating benefits in the day of, or you're clearing folks so that they can continue to look for jobs or be available or be eligible for benefits. And so those are the things that really matter. Let them know that we thank them from the bottom of our hearts, and to continue to let us know some of the things that they are really passionate about. I'm more than happy to help support. I know that under your leadership, you're very supportive, but let them know that there's also other people here thinking about them and in gratitude. All right. No, Michaela, do you have any announcements, any legal announcements you want to make?
No legal announcements today.
Okay. Or any announcement that you want to make?
Not today, but it was a lovely discussion.
All right.
I love
and
this
then
committee.
Lastly, I'll give Greta an opportunity. Is there?
No, I was going to say I love that Mariel highlighted a lot of the voluntary activities that are happening, just led by the wonderful, warm staff in the probation department. And I'll lift up one other. I wish Paul Lorenzo were still here, but one of my favorite things of the holiday season is to see how many staff-led additional opportunities for community gifting emerge. It's not surprising given the huge hearts that draw people to work for the county, but it's actually shocking how much time and energy people are putting in of the time they're not on the clock to organize these things and how much of their own resources. I'll just give one example as we kind of all head off into Thanksgiving. Some of the incredible staff who deliver our cancer-focused services at Valley Medical Center, particularly to folks who last season lifted up an example of folks who may be here providing domestic labor, either as childcare folks or working in folks' homes who are diagnosed with cancer and lose their jobs as a result of undergoing treatment. And so are without income, often without legal status and receiving care, and don't have just the basics around the holidays. And our staff end up gifting them huge amounts of personal gifts to try and brighten their spirits during the holiday season. And just the kind of depth of kindness of our staff across the county organization is always one of the things that I feel most grateful for as we go into the holiday season. And we will look for opportunities to share that with the community, because I think it really speaks to just the quality of the people who work for this organization. So thank you for that.
What a way to end our meeting. Thank you so much for sharing that. That was beautiful. I think that shows the spirit and the love that our teams have here. So with that, I'm going to adjourn our meeting and do that, and we'll see you in December. Thank you, everyone.